What is pharmacogenomics for hypertension? Imagine a world where your medication works perfectly for you, with fewer side effects and better results. That's the goal of pharmacogenomics in managing high blood pressure. It's a field that studies how your genes influence how you respond to blood pressure medicines. Because everyone's genetic makeup is different, some drugs may work well for one person but not for another. Pharmacogenomics looks at these genetic differences to help doctors choose the best medication and dose for each patient. High blood pressure is a complex condition influenced by many genes and environmental factors. Some people respond better to certain drugs like diuretics, beta blockers, ACE inhibitors, angiotensin receptor blockers, or calcium channel blockers. These responses can vary because of tiny genetic differences called single nucleotide polymorphisms. These are small changes in your DNA that can affect how your body processes drugs, how drugs target blood pressure regulation, or how your body reacts to medication. By identifying these genetic markers, doctors can move away from the trial and error approach of prescribing medication. Instead, they can select the right drug from the start, with the correct dose. This personalized approach can help control blood pressure more effectively. It can also reduce the risk of side effects, which often cause patients to stop taking their medication. Research shows that genetics can explain about 30 to 50% of how people respond to blood pressure medicines. Scientists use methods like genome-wide association studies to find genes linked to drug response. They also look at how different genes interact, which adds more complexity. Some genetic markers tell us if a person metabolizes a drug too quickly or too slowly, which impacts how effective the medication will be. For example, if genetic testing shows that someone breaks down a beta blocker too fast, they might need a higher dose or a different drug. Or if a person has a genetic variation that makes an ACE inhibitor less effective, their doctor might choose an alternative medication. This way, treatment becomes more tailored to the individual. Although pharmacogenomics is promising, it is still a growing field. Not all doctors routinely use genetic testing for hypertension yet. More studies are needed to confirm which genetic markers are most useful and how best to include this information in everyday care. In the end, pharmacogenomics helps create personalized treatment plans that aim to control blood pressure better, improve quality of life, and reduce unwanted side effects. It's a step toward more precise, effective hypertension management for each person.